joining us on the telecast and sharing your input on that. Moving on, some news coming in from Bangalore. First case of HMPV virus has been found in India. 8-month-old baby boy has been diagnosed with HMPV virus infection after he was admitted in a private hospital in Bangalore. As per the hospital sources, however, the baby has no travel history. The HMPV is a common respiratory virus that primarily affects the lungs and airways. It can infect people of all ages but poses a higher risk for infants, young children, the elderly and those with weakened immune system. Karnataka Health Ministry has not confirmed officially that it's a case of HMPV virus or not, but samples from the patient are being sent to the National Institute of Virology to confirm. Karnataka Health Minister Dinesh Gundu Rao's office has said that there are a lot of variants for this virus and they are waiting reports from the NIV to confirm that this is the same virus that originated from China. We have with us my colleague Daryl Miranda joining us on the telecast. Daryl, what are the details that are coming in pertaining to this report of this 8-month-old baby boy that has contracted this first HMPV case that we are seeing, though the reports of which are still awaited?
Absolutely, Ria. The HMPV case, the first case has been detected in India from Bengaluru, where an 8-month-old baby has been detected the virus, and the details are being awaited. And today in Mumbai also, the Maharashtra government has issued guidelines for the same, where it has said that the public should take precautionary measures, same as used to do in the COVID, like wearing mask, washing their hands with sanitizer. And today we also spoke to the Dean of JJ Hospital in Mumbai, Dr. Pallavi Saple, where she said that it is not as that dangerous like the COVID-19, but yes, the precaution, the guidelines has been issued by the state government in Maharashtra, and also she said that the people should take precautions while going out. If someone has cold, if someone has cough, they should consult their family doctors and should take the necessary precautions. In Maharashtra, if we speak about Mumbai, there's no case yet been detected, but a case has been detected in Bengaluru. But in Maharashtra, the state government has issued the guidelines for the same. Ria.
We also have with us Belly Thomas joining us on the telecast. Belly, we have seen that 2 new cases have been confirmed by the Health Ministry in Karnataka. So what exactly are the details that are coming in, and what initiative and actions that are being taken by the Health Ministry in Karnataka?
Ria, there is this 8-month-old baby boy who has been admitted at the Baptist Hospital here in North Bengaluru, and the baby is said to be in stable condition. However, the investigations by the doctor into finding out their travel history, both the baby or their parents have no history of travel anywhere to any foreign countries, including China for that matter. So this baby has been at present diagnosed with HMPV infection, and the baby has been isolated, and medical interventions are being carried out here at the hospital, and all necessary preparations or treatment are being given to the baby. So far, the baby is in stable condition, and there could be a possibility that the common cold can turn into pneumonia, as well as the hospital authorities says. However, at this point of time, it's not life-threatening, and the baby is in continuing care by the hospital staff. Meanwhile, the Karnataka Health Ministry is working on sending the samples of this baby to the National Institute of Virology in Pune, from where the confirmation, according to what variant of virus this is expected within a couple of hours from now. And as soon as the variant of this virus is identified, they would be communicating that with the health ministry in Karnataka, come out with the absolute variant of this particular virus. At this point of time, there is no confirmation as to this variant of virus is here in Bengaluru has originated from China. Meanwhile, all the precautions such as wearing masks, social distancing, isolation, all these are being are being given out as advisories for people who are having symptoms of cold or respiratory illnesses. And the people, the high risk category of people in this are children, elderly, and the pregnant women. And elderly would also bring in people who are under the palliative care. So these are the vulnerable people who can contract this particular virus very easily. So these people will have to have these advisories followed very strictly, Ria.
Belly, but another thing that to note is the fact that these kids, they have no travel history that have been tested positive. So how exactly does this work when it comes to HMPV virus, that these kids with no travel history have contracted it?
Absolutely, yeah. That is the question mark. This is a private hospital here in Bengaluru, where the 8-month-old baby has been contracted with this particular virus, and the doctors are probing behind the travel history or the people who have come in contact with this baby. Usually, if it's a baby, a lot of visitors would be there who would have come to meet the baby, or meet the parents as well. So the doctors are at present, what they're doing is like they are trying to make a list of people who have visited the baby, visited them, and were in contact with the baby. So probing into more of their travel history, they found out that this baby has or their parents have no travel history so far, and they've been here. They're residents of rural Bengaluru, and they've not come in contact with any foreigners as well. So this is somewhere the doctors are probing as to how could this baby would have possibly contracted this particular virus, Ria.
We also have with us Manohar Kestri joining us on the telecast. Manohar, as we have talked about it before, HMPV virus is not something new to India, and it has been detected in the past as well. But now, how is this different from the past? And also the fact this rapid speed, is it concerning, is it alarming or not?
देखिए फिलहाल अगर हम इंडियन हेल्थ मिनिस्ट्री की बात करें या ICMR जो रिसर्च संस्थान है इसकी बात करें, NIH पुणे की बात करें, सभी इसको देख रहा है कि चाइना में जो आउटब्रेक हुआ है HMPV वायरस का, तो क्या इसका स्ट्रेन वही है? क्योंकि भारत में पहले से ही इसका वायरस मौजूद है। 2005 से 2007 की बात अगर हम करें तो करीब सैकड़ों मरीजों की पुष्टि हुई थी, और खास करके इंसान को सबसे ज्यादा जो है सपेट में लेता है। 12 साल के बच्चे को अपना शिकार बनाता है ये वायरस, तो रेस्पिरेटरी ट्रैक सिस्टम सबसे ज्यादा इफेक्टेड होता है इसकी वजह से। तो NIH इस बात की जांच कर रहा है कि क्या इसका स्ट्रेन अभी चाइना में जो आउटब्रेक हुआ है दोनों का स्ट्रेन सेम है या फिर म्यूटेशन हुआ है, पहली बात। और दूसरी बात यह है कि भारत सरकार की ओर से 2 मामलों की पुष्टि इस सीजन का कर दिया गया है, क्योंकि हर साल सर्दियों में इसके मामले देखने को मिलते हैं। तीसरी बात यह है कि इसके सर्विलांस सिस्टम को बहुत ज्यादा बूस्टअप किया गया है, क्योंकि अब आप देखिए ये जो 2 केसेस बेंगलुरु में पाए गए हैं सेम हॉस्पिटल में भर्ती हुए थे। 3 महीने की जो बच्ची थी जो अस्पताल से डिस्चार्ज हो गई है, 8 महीने का बच्चा वो भी डिस्चार्ज हो गया, बैपिस हॉस्पिटल दोनों इसी हॉस्पिटल में गया था। कहने का मतलब यह है कि ICMR की टीम जो है तो लोकल सर्विलांस करके उनकी पुष्टि की है, और जो उनके संपर्क में है, जो उनके कॉन्टेक्ट में है उन बच्चों के, उनकी भी जांच हो सकती है, उनको भी मॉनिटर किया जा रहा है। और पूरे देश भर में इसके सर्विलांस सिस्टम को एक्टिव कर दिया गया है, उन्हें अलर्ट मोड में रखा गया है। वही हेल्थ मिनिस्ट्री की ओर से गाइडलाइन जारी कर दी गई है। अगर देश की राजधानी कैपिटल दिल्ली की बात न करूँ तो वहां पर सारे अस्पतालों को अलर्ट कर दिया गया है, उन्हें एडवाइजरी जारी कर दी गई है कि आखिरकार अगर इस तरह के सिम्टम्स के मरीज हैं, क्योंकि इसका नॉर्मल जो सिम्टम्स होता है फ्लू जैसा ही होता है, तो इन सबको लेकर के अस्पतालों में कितनी ICU बेड हो, क्या सेपरेट वार्ड होना चाहिए। क्योंकि आप देखिए जब 2001 में इसका डिटेक्शन नीदरलैंड में हुआ था, इसके बाद ये एवियन इन्फ्लुएंजा से इन्फेक्शन तो ज्यादा होता है। तो ऐसी स्थितियों में सारी चीजों को ध्यान में रखते हुए तमाम मेडिकल पॉइंट के लेकर के क्योंकि अभी तक जो ICMR की ओर से कहा जा रहा है कि यूरिन एसिड की तरह से अगर हम देखें तो कोई भी इस तरह से ग्रोथ जो कहें पर मरीज का वो देखने को नहीं मिल रहा है। और फिलहाल इसका जो स्ट्रेन है, क्या इसके वायरस के स्ट्रेन में म्यूटेशन हुआ है या नहीं हुआ है, ये जांच की जा रही है।
All right, Manohar Kestri and Daryl Miranda and Billy Thomas, thank you so much for joining us on the telecast and sharing those details. Meanwhile, my colleague Daryl Miranda has spoken to Dr. Pallavi